Chapter 7, Vulnerability and Inclusivity. Finally, I wanted to make a few comments on vulnerability and inclusivity from an EDI or inclusivity perspective. It's very important to protect people who are probabilistically known to be at higher risk of severe outcomes of COVID-19. Older adults, pregnant people, babies, people who are immunocompromised or have multimorbidity. One of the highest risk groups, probabilistically, is people with cancer. Having ever had cancer is a top risk factor for long COVID. People with cancer often have diminished vaccine antibody response, are at higher risk of infection, hospitalization, severe outcomes, and death. Even a mild acute infection often delays cancer treatments substantially. We've written 3 articles in JAMA Oncology on this topic in the past year. One of them was among the most widely shared on social media because patients do not want to get COVID while receiving medical care. We need universal precautions in medical settings, especially, and in all public spaces where inclusivity is valued, especially during high transmission. This is a part of having an inclusive society. I harp on this because many university students and faculty do almost nothing to make spaces inclusive to people with health vulnerabilities. Unmasked in-person only events are not inclusive and often characterized as unintentionally ableistic. However, it's also not that simple. It's not just protecting the so-called vulnerable. It's important to protect people with known vulnerabilities, that's for sure, but it's also important to protect people with unknown vulnerabilities, and that person might be you. Any regression model of severe outcomes is imperfect. I've seen 90-year-olds with extensive multimorbidity survive COVID hospitalization during the first surge, and 30-year-olds with no known comorbidities die. I've known several of them personally. We also know that who is vulnerable changes over time based on recency of vaccination, likely different subvariants, how many times somebody's been infected, and likely many unknown factors that we won't know for some time. Finally, there are many important outcomes beyond hospitalization and death, like long COVID, and anything that delays the onset or severity of long COVID is a good thing. Thank you.